Are you looking to become a medical coder, but just confused about the best way to start your career? When people try to research the best way to become a medical coder, they often feel frustrated because honestly, the information online can be so conflicting. Some say you need a degree, others say you need a certificate from a community college, and sometimes you'll find people suggesting some random online course. As someone looking into this industry from the outside, it's natural to feel overwhelmed and frustrated because you're not sure which path you should take. Plus, as a busy adult, you need to find something that can accommodate your current life situation, and even more so if you're already working or if you've got kids or other responsibilities. Well, guys, the good news is that you could become a medical coder without going back to school, without taking on massive student debt or financial aid, and without driving to some campus every day. In this video, instead of generic or outdated advice, I'm going to share a proven step-by-step blueprint that's already helped so many students like Shannon, Michelle, Alexis, and thousands of others start towards their medical coding careers in as little as 6 months. By the time you finish watching, you're gonna know how you could get your medical coding certification in as little as 6 months, how you could get your medical coding training from the comfort of your home for less than $2,000, little known resume boosters that could help you stand out as an entry-level coder. What I'm about to share with you could help you become job ready as a medical coder, even if you've got no prior experience in healthcare. This is probably going to be the most important video you watch this year, so make sure you pay complete attention. In case you don't know me, I'm Grant. I've been featured in multiple publications for my work in education. It's just my mission to help busy adults transition into new careers faster and without those big price tags. Okay, now let me tell you why I'm so excited about medical coding as a career choice right now. First, the earning potential. According to an annual salary survey, medical coders could make an average of close to $28 per hour or $58,000 annually. But honestly, the salary isn't even the most interesting part. What makes medical coding unique is the flexibility you get. While many healthcare careers tie you to a specific location, medical coding could give you multiple options. Some medical coders work in hospitals and healthcare facilities. Some work for insurance companies, and some could even find the opportunity to work remotely or from home. As a medical coder, you're a crucial part of the healthcare team, but yet it doesn't require any involvement on the clinical side. So the question is, how do you get started? Well, guys, I found that there are 3 key elements that could help you succeed as a medical coder, and let me break these down for you. First, you need proper training. The right training is literally the foundational piece towards your new career. You need to understand the principles of medical billing and coding, and the best way to learn all of this is through a proper training program. Now, it is recommended that you get your training from an accredited source, and if you could get a university certificate, well, that could be huge for your resume, but more on that later. Second, certification. After your training, you take a standardized exam conducted by nationally recognized bodies like the AAPC. For entry-level coders, the AAPC conducts the CPC exam. When you pass, you're a certified professional coder, and you can proudly say that you hold a nationally recognized certification. Guys, I can't stress how important this is. A certification is typically a key requirement in the eyes of an employer, as they know that you've been tested and validated by the industry's leading authority. Plus, according to AAPC's annual salary surveys, the average salary for a candidate holding the CPC is 20% higher than for the non-certified coders. Finally, third, hands-on experience. This is more of a resume booster because having real-life work experience in an actual healthcare setting could just set you apart as a beginner. Now, most people think this would take years, but I'm gonna share a hack with you where you could potentially get hands-on experience even before you start working. Now, look guys, the 3 elements that I have just shared, they all work together. Your training should ideally prepare you for both the career and the certification. Your certification shows employers you have the right skills and that you could be trusted with the coding and billing needs. And your experience demonstrates you could apply what you've learned in a real-world setting. So to start towards your medical coding career, you essentially need to focus on those three things. Now, as you can probably guess, it all starts by enrolling in that right training program. It is the foundational piece. Getting training wrong could mean you could struggle with the certification exam and possibly your career. You could waste time and money with training that employers won't take seriously. And in the end, you might just feel deflated and give up on becoming a medical coder. And guys, from what I've seen, it's not just subpar training that could set you back. Sometimes the type of training program that you enroll in could potentially create a lot of problems. Let me explain. So when it comes to training, most people typically think of full-time, on-campus college programs. With a full-time on-campus program, you could get a university certificate for your medical coding training. And as I highlighted earlier, well, that could be huge. University certificates typically carry a lot of weight and respect in healthcare. But here's the shocking truth about these programs. I feel they're just not designed for busy adults like you, and let me show you why. First, the costs are absurdly high. We're talking up to $20,000 just for the tuition. To afford this, students may have to rely on student loan debt or even financial aid. And mind you, paying off these loans, it isn't easy. You could be stuck with this debt for years. Plus, on top of the tuition, there are all these hidden expenses that nobody thinks about. Textbooks that cost hundreds of dollars, parking permits every semester, gas money driving to campus multiple times a week, and even childcare costs while you're in class. All of these little costs could actually add up to thousands more on top of your tuition. Now, beyond the insanely high cost of these programs, I feel there's another big problem: the time it takes to complete your education. These programs typically take up to 2 years to complete. 2 long years? I mean, think about what that really means. Driving to campus multiple times a week, sitting in scheduled classes that don't care about your work or your family commitments. If you're working or if you've got kids, this could be incredibly hard to accommodate this full-time education. Plus, because of these rigid schedules, students often start missing classes and falling behind. Now, most people are not able to foresee the problems that they could face with a full-time, on-campus education. I just wanted to highlight what you could be in for. Now, in recent years, as an alternative, people have started to look at online programs or local classes. With online education, you get the flexibility and convenience that you simply just don't get with those on-campus programs. And they're typically faster. There are some concerns as well. Many of these online programs or local classes are not through an accredited source. Because of the rising demand for medical coders, all kinds of organizations are offering these so-called medical coding training programs. But if your training is through an unaccredited source, it could potentially raise red flags in the eyes of an employer. Also, some of these programs don't even properly prepare you for the CPC certification. Some students find out they're not even eligible to take the exam after they've completed their training. Guys, in some cases, I feel the design of some online programs could also be flawed. Many of these online programs still force the students into scheduled Zoom classes. In other words, it's the same rigid schedule nightmare, but just through your computer screen. And finally, there's the cost. Most online programs charge between $3,000 and $5,000. And to me, this cost is still way too high. But guys, not all is lost. And don't worry, because in a couple of minutes, I'll show you how you could get online medical coding training for less than $2,000 and without compromising on the quality. Look, with these traditional options, which is what I call the old approach, you're forced into a lose-lose situation. I saw all of this and I knew something had to be done about this. I was honestly heartbroken seeing so many people waste time, waste money, and often give up on their dreams because the system just didn't work for them. So I decided to do something about it. I spent months talking with various stakeholders like employers and students and industry veterans. I had one goal: create the perfect template for medical coding training. In my opinion, here's what an ideal medical coding training program should look like. Well, first, it has to be 100% online and self-paced. No more rigid schedules, no more choosing between your job and your education. You should be able to study whenever it works for you, whether that's at 5 a.m. before work, or during your lunch breaks, or on the couch at night after putting kids to bed. Your training should fit your life, not the other way around. Second, your training must be from an accredited source. This has to be non-negotiable. On top of that, if you could get a university certificate for your training from a reputable university, well, that would be ideal. Third, your training should prepare you for the CPC certification. The program should align perfectly with what they need to know for that certification exam. Fourth, an opportunity for that hands-on experience. There needs to be something through which you can get that hands-on work experience after completing your formal training. Fifth, it needs to be fast. No fluff, no electives, laser sharp training that helps you get job ready. Ideally, it should take 4 to 6 months. And finally, guys, it must be affordable, preferably less than $2,000. Quality training shouldn't put you into debt. In an ideal world, these would be the ingredients for a top-notch training program. All right, then, what do you think about this, guys? Let's pull this template back on the screen once again, and I want you to take a hard look at this. What do you guys think about this template? If such a program existed, would you absolutely jump on it? Well, if the answer is yes, then I've got something incredible to share with you. If you've stayed until this point, you're serious about becoming a medical coder. Well, you're going to love this because I didn't just create this template, I made it a reality. Yep, this actually exists, and we call this the Preppy approach. The Preppy approach has already helped thousands of students start towards their healthcare careers faster. Listen to what some of the students had to say. Meet Trisha, a 41-year-old bookkeeper. Like many of our students, she was thinking about going back to school. But with a full-time job, traditional education would have meant putting her entire life on hold. But with Preppy, she could learn at her own pace whenever she had time. Or Jacqueline, she was working in customer service when she decided she wanted more from her career. Now, as a single mom, a full-time medical coding school just wasn't an option for her. Brittany came from teaching English, but wanted something different, a career that could provide a good living and allow her to help her mom in the future. She wanted to make a difference while securing her financial future. And then there's Alexis. As a busy mom, she was looking for a career that would give her options to work from home. The convenience and affordability of Preppy made it possible for her to make that change. Well, guys, these are just a few examples, and with Preppy, we're on a mission to revolutionize certification training. The Preppy approach is a step-by-step system designed to help busy adults like you get job ready as a medical coder in as little as 6 months. So guys, to get started with the Preppy approach, all you have to do is enroll in Preppy's Medical Billing and Coding training program. Now pay close attention, guys, because I'm about to go in depth with everything you get with Preppy. 100% online and self-paced. With Preppy, you get complete freedom from classroom education. Your training is 100% online, giving you the convenience of learning from the comfort of your home. Plus, you can move through the course at your pace and on your schedule. Look, life can be busy. You might have a job or family commitments or other responsibilities. I feel like traditional programs can sometimes force you to choose between your life and your education. With Preppy, that problem disappears. You can study in the morning before your kids wake up, during your lunch break, or on the couch at night. Your schedule, your rules. No more missing your kids' games for class, no more begging your boss for time off, and no more expensive childcare during those lectures. Your training fits your life and not the other way around, in partnership with an accredited university. Earlier I mentioned how having a university certificate could be huge for your resume in healthcare. However, to get that university certificate, you would typically have to enroll in those on-campus programs with all the hassles and expense that comes with it. But that's not the case with Preppy. Preppy's program is in partnership with a prestigious, nonprofit, accredited university. When you complete your training program, you get a certificate of completion from this accredited university. Think about how proud you'll be when your coworkers see that certificate hanging on the wall in your office. That feeling when you can confidently say that you got your training through a respected university. Next, it's faster. Preppy's program is self-paced, meaning you could complete the program in as little as 4 months. Not years like other programs, months. With Preppy, you get that laser-sharp training focused exactly on what you need to know. As I said earlier, nobody wants to go to school for 2 years, and students today, they want to start their careers faster. Well, with Preppy, you could do that. But we also understand that life happens. Kids get sick, work gets crazy, things come up. That's why you have complete access to Preppy's program for a full year. You can pause, take breaks, and pick up right where you left off. No more missed classes, no falling behind, and no stress. Our self-paced model also gives you the freedom to move at your pace, and if you want, take the same lessons multiple times. Ready for CPC certification. With Preppy's certification program, you get all the skills to crush AAPC's certification exam. After completing your training with Preppy, you can apply and sit for your certification exam to get that awesome CPC title after your name. Our program is updated every year to stay in line with the latest guidelines. Plus, it comes with interactive quizzes that mimic the questions you could get on that certification exam. Our program is also beginner friendly, so even if you're new to healthcare with no experience, you can easily go through the program. Our interactive slides, presentations, and quizzes are designed to help you learn step by step. Now guys, something to note here. To get the full CPC certification, you need to have a minimum of 2 years of medical coding experience. But if you don't have that, you'll get the CPC-A until you meet those 2 years of experience. You pass the same exam, it's just that the AAPC awards the apprentice designation until you get those 2 years of medical coding experience. Now, here's the cool part. AAPC allows you to reduce the apprentice designation to just 1 year if your training program meets 80 contact hours of coding preparation. Well, Preppy's program will satisfy the course portion of those 80 contact hours. So to remove the A, you would just then need 1 year of experience working in the field. So instead of 2 years of experience, Preppy helps you to just need 1 year of experience to get that awesome CPC title. And in the meantime, you'll have the CPC-A title. This is just another unique benefit that you get with Preppy's program. All right, next. Eligible for an externship opportunity. With Preppy, you could also be eligible for something that's incredibly valuable, especially as an entry-level candidate, an externship opportunity. Through this externship, you could experience what it's like to work at a local hospital or healthcare facility. We help students coordinate these externships regardless of where you live across the United States, and it's available nationwide. Externships are valuable because they could give you that hands-on work experience, which you can then cite on your resume. So essentially, with your formal training and certification prep, you're also eligible for us to assist you with obtaining that real-life work experience. And finally, guys, there's one more thing. With Preppy, you get job assistance services. When you complete the program and meet certain criteria, our team will work with you to help get that resume done, help schedule interviews, and connect you with companies looking to hire medical billers and coders. All right, to summarize, 100% online self-paced training. university certificate, ready for CPC certification, externship opportunity for hands-on work experience, job assistance services. In this clouded landscape where so many organizations are offering subpar training programs, with Preppy, you get something that's totally unique, something that's designed for the modern busy adult. Preppy makes it easy and convenient to get your medical billing and coding training, and also helps ensure that you're job ready and competitive based on what employers likely want. With Preppy, we're so proud to say that you just get the best of all worlds. Now, the big question, how much does it cost? As I highlighted earlier, on-campus programs are absurdly expensive, and some online programs also come with big price tags. Preppy, on the other hand, is insanely affordable. By the way, guys, you can also enroll using payment plans as well. Ultimately, Preppy gets the seal of approval from students across the country and industry veterans. Today, you can finally take that first step towards starting towards your dream career. To check out our program and enroll, you can click on the link shared below, and I'll also add it to the pinned comments. And guys, when you click the link below, you're gonna go to our course page, and you can complete your enrollment online to start right away. No waiting for semester start dates, no applications. You can start learning the same day. You can also chat with our amazing customer support team if you've got any questions related to the program. So click the link below to enroll today. Just take a moment and imagine that a few months from now, you could be confidently introducing yourself as a certified medical coder, being proud to tell people what you do for a living, and building a real career in healthcare. Think about that feeling of accomplishment when you could see your certification hanging on your wall, getting your first paycheck as a healthcare professional, and making a difference in patients' lives every day. All of this could be possible, and the first step is to get the right medical billing and coding training. And if you like what Preppy has to offer, you can click the link below and enroll today. Guys, if this video was helpful, please hit that like button. It really helps us to grow the channel. And if you know someone who's been dreaming of starting a career as a medical coder, then you can share this video with them as well. All right, guys, I hope you enjoyed the video. This was Grant signing off. Take care.